George Kilpatrick Inspiration for the Nation, celebrating people we feel good about. October is Breast Cancer Awareness Month. And so we wanted to take this opportunity to really provide our listeners with a reminder of the importance of breast cancer screening during this month of October. Here's the truth and the real deal. Black women face higher risks of breast cancer than other racial and ethnic groups. And Black women have higher death rates. So what can we do? Denise Baker is the Director of Quality Improvement and a registered nurse at Syracuse Community Health, and she joins us now to help us to reduce those morbidity rates and make sure that you are getting the screening that you want, that you need, and that we can encourage you to get the screening that you want. So let's talk about this, Denise. Some very troubling statistics, and I know you have some as well. Thank you for coming on the program.
Thank you for having me. I appreciate it. About 1 in 8 women will experience, have a lifetime risk of experiencing breast cancer. What is alarming is that while Caucasian women are most likely to be impacted, African American females are most likely to die from breast cancer. So there's a 40% mortality rate associated with it. And that is really coming from a place of screening and making sure that early detection is the key to making sure that cancer is caught early and treatment can start immediately.
So what are some of the reasons why we're seeing a higher death rates with Black women? This is what I heard, okay? Mm-hmm. That by the time Black women in particular in that research category get screened, sometimes it's too late, that the cancer is more aggressive. And I might not be saying it in the medically right term, but that's what I understand. Am I right?
Yes, you are correct. And so one of the important takeaways from this whole conversation is early detection, right? Making sure that we are doing breast exams, knowing what our breasts look like before our menstruation, after our menstruation, being just familiar with our overall body. One of the areas that women of color often are impacted is that they are not getting screened early enough and coming in to see the providers or talking to their doctor about changes that are happening with their body. Also, knowing some of the risk factors that can impact your potential to getting breast cancer, such as your body weight, having a diet that's high in fats and exposure to alcohol and environmental chemicals. Believe it or not, acrylic nails have some link just because of the chemicals being introduced into the air, into the body, and have an impact on increasing your overall cancer rate. So making sure that prevention is key, making sure that you check in with your providers and get your mammograms completed at between the ages of 40 and 72.
So when should girls be taught how to do the self-breast exam? Or women and girls?
So when young girls turn to women, age into womanhood, and become a woman, it is important just to be familiar with their breast. The American Cancer Society initially had come out with a recommendation for self-breast exams and making sure that they are performed regularly. That has changed into making sure you're aware of what your breasts look like. So look for any dimpling. Is there any discharge? Is there any wounds that maybe you thought was a pimple and it didn't heal? For anything that's unusual, those are the things that you really want to talk to your provider about. So it's not that when you turn 40, all of a sudden you start getting your mammograms and that's when you should be concerned. You should, from the time that you start developing breasts, be aware of any abnormalities. Again, not being aware, African American women are, if they have a history, have a more likelihood of developing breast cancer earlier. So maybe they're in their 30s and they notice that there's something going on. They really need to go and speak with the providers.
So you should start your screening for mammograms at what age? Is it 35 or is it 40 or what age is it?
Right. So it's really based on your risk factor. So if you are just of average risk, and even including women of African American descent, you still want to start at age 40. 35 is if you have, you should be having that discussion with your provider, and you and your provider together will decide whether or not a mammography or an MRI is needed for your particular screening. Close relatives, first degree relatives who have had a history of breast cancer or any types of cancers earlier definitely meet that criteria, and you may want to get a mammography at that particular time. Making sure that, again, if any of those risk factors, if you have the BRCA gene, that's something that is often discussed with patients when we're planning on looking at when to start a mammography.
Yeah, I'm just listening to you and I'm thinking, are for the clients that come to the health center, obviously accessibility, the reason why the Syracuse Community Health exists is to provide health access to all parts of the community. And so when you talk to your patients and when they finally come in and you're able to prevent the scare from happening, what are they saying to you as to why they took so long to come in if they did?
Yeah, work, family, priorities sometimes get in the way, are misconstrued in regards to overall self-care and help. And it's important while you're taking care of your family to make sure that you also take care of yourself. So identifying that you are the priority, even though you have to go to work, you have to take care of the kids, you have to, whatever you want to add to the end of that, you feel that you compelled to do. Screening, early detection is really the key to making sure that we're able to prevent this.
Yeah,
Race,
because it's not inevitable, right? Not everybody, you know what I mean? Some people kind of think, "Oh, I may get it," but it's not inevitable. It's preventable.
correct. And still, a lot of people are scared, right? So the key here is to bring a friend. Tell a friend to bring a friend, and let's do this together. Let's connect with each other and have some of those hard conversations, some of those real conversations, and let's do some research and dispel some of the myths. Um,
So, what are some of the myths?
so some of the myths are that if you have breast cancer, then you're automatically going to have your breast
Removed.
removed, and or that you'll have chemo and you'll have no hair. That is not true all the time. And a lot of cases, again, if you can catch it early and identify that there is an issue, then some of those procedures can be avoided.
You know, some women with the gene do elect to have surgery. Some do, right? Pre-elective. I don't know what you call it, but like, okay, yes, yes,
Right. Yeah.
yeah,
Elective surgery. Mhm.
yeah, elective surgery. Because they don't want the idea of that, and that's traumatic for some people. The other thing that I heard is that the mammograms are uncomfortable, or the clamps are cold, or and things of that nature. How have how has medicine advanced so that those are not issues anymore, or are they still issues?
The procedure is the procedure, unfortunately. And so that's why it's good to have some support around, because it is not comfortable or fun. Some of the things
You
that,
keeping it real? Are you keeping it 100? Right?
right, right, it is an uncomfortable truth, is what it is. And when you have support, I have a couple of friends that have been impacted. And so we do talk about having to deal with the uncomfortable truths, and that is one of them. Nobody likes to do it. So we joke around and we laugh and we decide when the next one is going to go. And we encourage them and we connect with them and we support them because nobody likes them. But the last thing you want is for something to go wrong and you didn't do anything.
So one of the things we could do is, so sisters, you know how sisters like to do the paint and sip?
Yes.
Why don't y'all have a mammogram and sip party?
Well, we laugh about that, but interestingly enough, and this is just, you'll have to excuse me here for a moment, but Syracuse Community Health Center Health has Syracuse Community Health has a state-of-the-art mammography center, and it is absolutely beautiful. It's an incredible place to go, and it is couch in there, and you can sit down and you can have some tea, and if you bring a friend, you can have a little bit of a conversation before one of you go in and then the other one goes in. We would love to have folks to come on in and get screened and prevent.
Listen, take my idea, round up the D9 sororities and the Eastern Star and the NCNW and all of the rest of the LKM, all the rest. Round them up and say, bring your friend to the Syracuse Community Health. We're going to have a mammogram and sip party, BYOB.
I'm going to get that clear with Dr. Reed.
So, tell Dr. Reed, yeah, you have a BYOB mammogram and sip party, and it'll be a lot of fun. But the thing is, we're saving lives because, again, Black women they have a 40% higher death rate from breast cancer than, even though the incidence is lower, the death rate is higher by 40%. So with that being said, this is a serious issue, sisters, right? So to the fellas, if you're listening, if you've got a loved one in your life, please encourage your loved one to get that screening so that we can prevent these statistics from happening. It's very important. So tell a friend, take a friend. October is Breast Cancer Awareness Month. And what else do we need to know about this very important issue?
Well, I think that you pretty much have said it all. I think that it's important to not be scared of the unknown. We're here to help you. We're here to connect with you. We're here to walk you through it. There are a lot of resources. So let's just say you don't have insurance. Onondaga County Health Department has cancer screening services. There's Shades of Inspiration out there, and they will support you. And we work closely with both of those groups and a number of cancer services as well. So there's a lot of support if, unfortunately, you're one in that eight, right? But we can do this together and we can stomp out cancer.
Stomp out cancer. Syracuse Community Health, phone number 315-476-7921. Now, you mentioned one of the barriers is work. Can you schedule at a time that's convenient to the working mom?
We are open from 8:30 to 5:15. And so if there are some issues that are surrounding that, we are open to serving our community and whatever the needs are for our community. We currently are not open in the evening or on weekends. However, if that's what a need is, then we're willing to look at the need.
Denise Baker is the Director of Quality Improvement at Syracuse Community Health, a registered nurse, and you can give them a call at 315-476-7921. They're a partner with Inspiration for the Nation. We've partnered together this month to raise awareness around breast cancer awareness, particularly among all populations, but for the folks I'm talking to, for Black women in particular. Denise, thank you so much. And don't forget, mammogram and sip.
We have coffee and tea. Come on down. That's right. That's right.
I didn't say what you were sipping. I just said mammogram and sip. on inspiration for the nation.